So good afternoon, everyone, and thank you for joining us for our webinar today. For today's webinar, we're happy to welcome Julie Wright of Covenant Health to our program. She is the nurse manager of their virtual program at Covenant. She'll present on the future of nursing care, and we'll have time for questions and discussions at the end of the presentation. We have a few introduction and housekeeping slides, and then we'll jump into presentation. Just letting you know, we have Benjamin Greif here, our MS2 medical students, and of course, my partner, Dr. George.
Hi, hello.
So, Benjamin, could you just give us some?
Oh, yeah, this one, right?
Yes.
Okay, so this is an educational activity. This educational activity is a project of TexLa Telehealth Resource Center, a federally funded program with F. Mary Hall Rural and Community Health at T2HSC, as well as Well Ahead Louisiana with generous support from HRSA, Health Resources and Services Administration.
And a quick reminder, Benjamin.
So this is the reminder that CME credit is available for participants of this webinar, and a link will be at the end. A link to take the survey will be provided at the end of the presentation, as well as emailed to attendees.
And this is new. We also have CNE credits as well, starting
good.
today, Julie, just because of you. Then there are some tips, Benjamin.
So these are some helpful tips for our webinar and for ensuring that you receive your CME credit. Please make sure everyone is muted, and please type any questions or comments you may have during the presentation into the chat box. Dr. Santos will now introduce our speaker for today's webinar.
Actually, Dr. George will be introducing it.
Yeah, today I'm delighted to introduce Julie Wright, who is an accomplished nurse leader and with a strong focus on innovation, new care models, and a seamless integration to their telehealth technologies. With a wealth of experience and expertise, she serves as the nurse manager of the observation unit at Covenant Medical Center. Julie Wright has done several initiatives to improve the hospital throughout and address at the length of stay. Her dynamic leadership was instrumental in the implementation of the Providence pioneering virtual nurse pilot program, which is marked with another success for telehealth in nursing. Throughout her career, Julie Wright has garnered the recognition with her exceptional contributions to healthcare, including the prestigious Daisy Award in 2020 and the Baylor President Award and the Baylor CEO Award of Excellence in 2030. With a track record of exemplary achievements and a master's in nursing administration from University of Texas, Arlington, Ms. Wright continues to be a forefront in advancing nursing practices and enriching the patient experiences. Thank you very much for being here today, Julie, and we hand it over to you now.
Thank you very much. Thank you. I am so excited to be here with you today. Let me share my screen. Okay, can everyone see the correct screen? Yes?
Yes.
Okay. Excellent. Well, good afternoon. Today, I have the pleasure of discussing virtual nursing with you. This is a topic I am incredibly passionate about, and I think we need to be talking about it and spreading information about it. So I can't wait to share the overview of virtual nursing and what's happening in the US today. So just to give you an overview of what we're going to be discussing over the next 45 minutes, I really want to start by talking about what's happening in nursing in the United States. I'm going to set the stage and describe the common nursing models so that you can understand how innovative virtual nursing is, as well as talking about healthcare in general and the different market forces that are increasing the need for virtual nurse technologies. We're going to be looking at key takeaways that you should consider when you're considering implementing a virtual program, as well as looking to the future on where I think this technology is going to be leading us. So I think everyone on this call, I'm sure, is aware that we have a nursing shortage in the United States. Depending on what article you pull, you may see a variety of different numbers, but the takeaway is the same. We do not have enough nurses to take care of the patients in the hospitals. So according to the National Council of State Boards of Nursing, we lost approximately 100,000 registered nurses at the bedside during COVID-19 related to retirement and burnout. A recent survey that they did indicated that an additional 610,000 are planning on leaving in the next 3 to 4 years related to stress and burnout. The next number, which I've seen this number several other places as well, is very troubling. It is related to RNs younger than 40. Close to 200,000 are saying that they're also considering leaving the bedside. So what we're seeing is that, nurses, we're graduating nurses at huge rates. We have nursing schools everywhere, and yet they're coming to the bedside and within a year or two are saying, I don't know if I can keep doing this for the next decade. And that is really a problem. So it's not just an issue of we don't have enough nurses, we need to make more nurses. It's once we have the nurses, how do we keep them engaged and wanting to stay in the profession? So common nursing models of care, total patient care is primarily what you're going to see in the acute care hospital setting. This is really where you have a nurse caring for a group of patients, and that nurse is completely responsible for taking care of that group. This is what you see taught across the state in nursing schools, and really the most commonly utilized model of care. Team nursing is used in certain areas where you have RNs and LVNs collaborating together on patients, and the work is divided up based on skill level. And then primary nursing is another term that we hear, and a lot of people use primary nursing and total patient care in conjunction with each other. But the main takeaway for both of those models is that you have one nurse caring for a group of patients, and the nurse really is responsible for everything that's going on with that patient. So when I think about total patient care, this is what I picture in my mind. So I tried to take what I was imagining and put it into an image for you so that you could understand it too. This is a nurse. This is total patient care. You are lifting all of the weight. And I think that when you look across the United States, we hear nurses saying, it's too heavy. I need lower patient ratios. These patients the acuity is too high. It's too much. I'm feeling burned out. And I think when you look at it in this context, you can understand why they feel that way. My issue with the ratio argument or the acuity argument or anything that has to do with lessening the weight is that you're not changing the outcome. Whether you are asking someone to lift 50 pounds or 100 pounds, at some point they are going to reach a state of exhaustion, right? They will reach burnout. And so if the end result is burnout, this can't continue to be our primary model, because we need the end to be different. Another thing I want to say about this picture, notice she is not the only one in this picture. I think that this highlights how difficult it is to have true teamwork in a total patient care model, because although she is not the only person in that room, her helping another person requires her to set down her weight, walk over there, and then who's lifting her weights and answering her call lights when she's helping that other person. And so you can start to see where that stress and the burnout and the overload is really highlighted in this illustration. So what do we go to instead? Well, I think the goal should be to create a pulley system. And what are the different pieces of the pulley system? I think leveraging technology, leveraging telehealth technologies, leveraging ancillary staff in new ways are all going to be components of creating a new model where you can continue to lift that same amount of weight indefinitely without reaching a state of burnout. And so I want you guys to keep this image in your mind as we talk about the role of the virtual nurse, because this is the goal. This is what will keep the next generation at the bedside. So nursing as a profession really has reached a tipping point in this post-COVID era, where nurses they're looking for something different in their profession. They want to see their profession grow and change, and they want to see that in several ways. Technology is a huge piece of that. Nurses are definitely calling for technologies to be brought into the hospital system. We see that technology is used in every other sector of this world. We don't need to be practicing with technology from 50 years ago in the hospital system. We need to be using what is available. Also, we are seeing an uptick in professional development. I would say more and more I am hearing about nurses going back to school, because you have some that are saying, I'm burned out, I'm going to leave. And then you have others that are saying, well, I'm not going to leave. I'm going to grow so that I have opportunities to do something else. And so we are seeing a really large number of nurses at the bedside that are going back for their graduate degrees or becoming nurse practitioners, and that they're really expanding their skills. And we are seeing nurses used in virtual ways, and that really highlights the skills that nurses have. So when you look at market forces and challenges that are really driving these innovations, looking at healthcare, when you step back and look at healthcare in general, post-COVID, we have very, very sick patients in the hospital. We have patients that have post-COVID syndrome, and so that has created a population that is sicker than ever. But there's something else at play because of the change in the way that we engage with the different payers and the qualifications that patients have to meet to be inpatient. Patients that typically would have been served in the hospital are now being served outpatient. And so what that does is that previously you might have a patient group where your acuity is pretty mixed, and you have low acuity and you have high acuity. Those low acuities, they're not being admitted anymore, right? So now we have high acuity all of the time. And that really changes the demand of the level of care and the specialization that these patients require. And so what the market is really forcing is this need for a digital support system, right? The digital piece and that innovation piece to create that pulley system. We're also seeing in healthcare, it's constant challenges with staffing. So I'm sure everyone has heard about travelers. That comes in, it ebbs and flows. So there's sometimes where hospitals are in need, a great need of travelers, and then they start to fill up with regular staff, and the census drops, and then all of a sudden, boom, Christmas hits and you're desperate for travelers again. That is a hard environment to live in year over year. Not only are healthcare institutions struggling with nursing challenges, but they're also struggling to staff hospitalists and physicians, PT, physical therapists, other kinds of therapies. We are really, healthcare in general is struggling to keep people in the acute care hospital setting. And so what that does is it puts more demands on the people that are there, right? We're really pushing people to their limits. And so I do think that whatever hospital you're at, there's a good chance that you feel that sense of urgency to make changes now to address these continued challenges. And what that is pushing us towards are new models of care. So virtual nursing is not actually a new concept. I think when you look at the history of telehealth, which has been around for decades and decades, you can find nurses engaging in those programs. And so anytime that you have a nurse that is using technology, whether it was a telephone years and years ago, or whether it is the video conferencing now, virtual nursing is present. Whether you're calling it virtual nursing or whether you're calling it telenursing, this is really not a new concept. What is new is this idea that we're going to take this technology that's been around a long time, and we're going to put it in the acute care, med-surg, general med-surg areas. So for the last 20 years, this technology has been used in a couple of different ways, pretty broadly across the United States. Tele-ICUs are very common. I listed just a few healthcare organizations that have a tele-ICU program, but there are so many, I would have been slides and slides of lists. But what TeleICU does is it uses that telehealth technology to allow critical care nurses and physicians to contribute to the care of the critically ill remotely. That they can also do remote patient monitoring. Another way that this technology has been used for decades is hospital at home. You know, I touched on this earlier about patients being treated at home versus being treated in the hospital. And what hospital at home is where you take a patient that traditionally would have been hospitalized. Maybe they need antibiotics. And instead they get to stay at home, and their care consists of some in-person, but also some virtual care using, again, that telehealth technology to engage with the nurses and the hospitalists. So what's happening in 2023 that is so different? Now, again, we are seeing the same technology that we saw in the tele-ICU and that we see in hospital at home and that we see every day in telehealth being used in the acute care setting for inpatients. There are dozens and dozens of programs across the United States. There are many healthcare organizations that are embracing these changes. This is just a snapshot that was reported by Becker's on 2023. So in Philadelphia, they have a virtual program where the virtual nurse is doing admissions, discharges, patient education. These are terms you're going to hear me say many times over the next couple of slides. Nashville, same thing, admits, discharges, patient rounding. Idaho, they're doing admission, medical history, they're doing the discharge. Cincinnati, the nurses are beaming in through the televisions and they're doing the admits, the patient education, they're reviewing medications. And then in Texas, we see that there's a program that they're using that technology for follow-up care for violence and trauma survivors. So again, I think that there's some interventions that really stand out that people are clinging to quickly and initially as they implement these programs, because it is so easy for the virtual nurse to accomplish those tasks. So you're going to see those trends as we go through this. This is really just the simplest form of what the role of the virtual nurse is. And then in the next couple of slides, I'm going to dig a little bit deeper. When you add a virtual nurse, you are changing the model of care. The goal is to reduce that administrative burnout and move from the lifting weights to yourself to a type of pulley system. Do I think all the pulley system pieces are in place yet? No, I think those are yet to be revealed, but I think it's coming, right? So the virtual nurses in most programs are doing some combination of these tasks: admissions, procedure checklists, medication reconciliation, patient rounding, discharges, acting as a resource nurse, and providing patient education. So remote patient monitoring. Because the nurse is virtual, they oftentimes, wherever they're set up, whether it's at a command center or at their house, they've got multiple screens. They have the screen that they can see their patient on, and then they're also able to be in the EHR. And so they're able to monitor things like vital signs in real time. Also, depending on the program, they can beam into the patient's room and they can see the devices that the patient is connected to, and they can monitor the vital signs in the patient data that way as well. This, again, is just another layer of added quality for that patient to have someone with the knowledge and expertise to know what to do with that information, really watching for those things. This plays into the real-time clinical assessments, being able to beam in and evaluate those patients. And if they have seen those patients, for several days, they understand what that patient's baseline looks like. And to be able to say something is off, I need to call someone, or maybe they witness someone having a seizure, or maybe the patient is reporting pain. But again, although they are not able to physically lay hands on the patient, they do possess the knowledge and the skill set to be able to do some of these clinical assessments virtually. Timely interventions, notifying bedside caregivers and providers about critical labs. We know that nurses spend a lot of time in the chart, but they do not live in front of that computer because they do have to get up and walk away. So to have another set of eyes in those charts, looking for those alerts, I think can really be beneficial. Medication management. This is a really important one. When we talk about prior to arrival medications, when a patient comes with a list, this intervention can make or break a hospital stay. And if it's something that somebody rushes through and it's not entered accurately, that really impacts the physician's ability to treat that patient effectively if they do not have an accurate medication list. And so to have a virtual nurse that can really commit to that and spend the time that's needed making sure that that is accurate in the computer can really lead to better outcomes for the patient and can really give the physicians the confidence to know that that prior to arrival medication list in the computer is accurate. Communication and collaboration, engaging in virtual rounds. Whether your virtual nurse is on a TV screen in the patient's room or on a rolling cart or on an iPad, what a powerful thing to be for a physician or hospitalist or specialist to be able to round on the patients and have a nurse virtually with them to where they're not pulling the bedside nurse out of another room, but they do have someone that's there for those conversations. That virtual nurse can then follow up with that patient later when that patient has questions, and the nurse can say, yes, I heard the physician say this. This is what he was referring to. That can be incredibly powerful. Care coordination, having a virtual nurse that is beaming in and engaging with the family and the patients to really make sure that all of their discharge needs are met, and helping the inpatient social work and case management teams so that nothing is missed and we don't have a patient come back 3 days later because we didn't send them home with the right equipment. Early identification of risk factors. There's several different pieces in a variety of different EHRs that trigger you, a Muse score, that type of thing, that something might be wrong with that patient. But if you don't have someone looking for that information, it doesn't actually benefit the patient. And so to have a virtual nurse targeting those types of things can really impact quality. Documentation. This is a huge one. Bedside nurses in every setting spend hours documenting. And to be able to take some of that burden and put it on someone else that's part of that team, to where you're not sacrificing the documentation, things are still getting put in accurately, but now you're shifting some of that responsibility. That can really help to decrease the administrative burden on the bedside staff. Mentorship and training. This is I think one of the most important pieces. So when you look to go back to the mass exodus of nurses, right? When those nurses leave, you're not just losing a staff member, you're losing their knowledge and experience. And so to give experienced nurses that maybe have decided for whatever reason, whether it's physical or mental, that they don't want to continue at the bedside, to give them an opportunity to continue to share their experience and their wisdom. This is huge, right? They can work in the virtual setting. They're able to mentor those new nurses so that you don't end up lopsided on your unit with an entire shift of new grads where the most experienced person has been there 2 years. We know in nursing how important those experiences really are. And we rely on our experienced nurses to guide and mentor our new graduates. And so if we can't keep them here physically, certainly keeping them at that setting virtually so that we can give those new grads time to grow is going to be really impactful to our profession. Workflow optimization. I think when you think about workflow optimization physically, there are some challenges that it becomes challenging, right? Because you're running, you're answering call outs, you're doing these different things. I think looking at the workflow of someone working remotely is an incredible opportunity to find new ways to enhance technology and to use different technologies and incorporate that into their workflow because they don't have the same barriers of physically running room to room. And then patient advocacy, really advocating for the patient's needs. To have another voice advocating for the patients is always a positive thing. Empowerment of the bedside staff. When you feel like you're drowning and you're suffering with burnout, you're probably not feeling very empowered. And so to give them a partner, to give them someone to collaborate with, will hopefully give them a sense of empowerment and will give them their voice back. Data-driven decision-making. I think this really plays into future technology that I anticipate will be brought into the hospitals, where we know that we have mass amounts of data that are going to impact clinical decision making, but how do you incorporate those? And so I think bringing in virtual nursing, it's how you open the door to that, and then you start incorporating those new data-driven technologies into their workflow. Patient engagement and satisfaction. So this is key. I recently had a family member last year in the hospital, and it was such an uncomfortable experience because we are an on-demand society. Anything I want to know, I can Google it. Ask me any question and I will Google it and I'll find you the answer. Any movie I want to watch, I can find on the internet. If I want groceries delivered to my house in an hour, I can get on Walmart.com and I can make that happen. I can really do so many things at, just an instant on just my cell phone. But you put me in a hospital room with a family member, and now I am at the mercy of that nurse. They are the keeper of information. They're the keeper of the plan. They're the keeper of the medications, and it makes you feel incredibly helpless. And you really feel like, okay, when are they going to come in again? When are they going to come in? And so that causes patients and family members a great deal of anxiety when they come into our hospitals. But when you introduce a virtual nurse, and now they can access a nurse, a clinical nurse with access to their records that knows what's going on with them and what the plan is, when you can access them at the touch of a button, that completely changes that patient and family member's experience. And instead of sitting there for 2 hours, nervous and anxious, waiting on the nurse to come back so you can ask a question, you can have your questions answered almost immediately. And then the rest of your stay, your anxiety is decreased. Rapid response and crisis management. Imagine running a code and having a critically trained nurse as eye in the sky, being able to observe that and take notes and document. That can be incredibly powerful, as well as if she hears someone ask, well, what was their magnesium or what was this, being able to be in the EHR and look those numbers up and shout it out to the team. I think that is really can be impactful in those stressful moments. So I know that was a lot of intense slides about what the virtual nurse can do, but what I want the takeaway for that to be is that I think before you implement a virtual program, what people tend to focus on is what the virtual nurse can't do. And I think that those slide after slide, I think that was 4 or 5 slides, really shows everything that the virtual nurse can do. And that really should be our focus, because when you get down to it, they can almost do more virtually. That list is longer than their I can't do list. So reasons for starting a virtual program. Obviously, it addresses the staffing challenge. It gives you that door to start bringing in these telehealth technologies to the acute care inpatient setting, which we really need to start focusing on. It gives you an opportunity to explore new models of care, and it really can empower your team, and it can give you an opportunity to keep your nurses at the bedside longer, whether it's virtually or in person. So building the business case, you need to be aligning this with your organizational goals. I would say probably just in the last 20 minutes, I have put enough out there for you to be able to take any organization's goals and align it with something that a virtual nurse can do. Engaging key stakeholders. This is so important, because in healthcare, we tend to get incredibly siloed. And, we have fantastic CEOs and CFOs and administrators, but that does not mean that they fully understand what's happening at the bedside. So bringing them in early, explaining like what we're talking about today, models of care, what the nurses are experiencing, the need for change, is going to help them engage in new programs like this. And then quality. I think several times I have said, as we were going through those roles, this could help with quality. This could help with quality. At the end of the day, if we're providing patient-centered care, we need to be looking for opportunities to make our quality better. And then, just addressing the workforce shortages. If you can't have them here physically, how are you going to get that knowledge and experience in your hospital? You have to find a way. So when you start to begin to implement a virtual program, you want to be really strategic about it, and you want to think it out. you want to engage your frontline staff. Even though I think most bedside nurses would agree that they want change, when you start telling them that you're going to change, you'll be surprised how many people push back because change is really hard. And total patient care is deeply ingrained in how a lot of people identify themselves as a nurse, and it's part of their identity. And when you start to shift that, it is a challenge. And so engaging them from the beginning so that they are driving that change is so important. You want to empower them. You want to give them permission to think outside the box. Actually, you want to give them permission to throw the box away, and you don't want to create a new box, right? No more boxes at all. Give them permission to try it one day, and then the next week try it a different way, right? We don't need to create a different version of total patient care that is going to hamstring us for the next 20 years. And then, of course, launching a pilot program to test it out. So that you're setting realistic expectations for the staff, that they understand that this is a work in progress. You're not going to immediately find success. That's not how pilot programs work. But the most important part is that you are actively working towards that pulley system, right? And just that, and I've found from personal experience, can be incredibly inspiring for the staff because it gives them a new hope and it gives them the light at the end of the tunnel. Make sure that you're getting continuous feedback and making refinements. I think some of the mistakes we make sometimes in change management is we put these timelines, these check-ins. Well, we're gonna start it on this date, and then in 30 days we're gonna check in. No, why don't you check in 2 days? Because a lot of times there's things that you try it for a few days and you already know this isn't working. Can we adjust? Can we adjust? And if you adjust along the way, instead of only checking in every 30 days, you're going to end up with better results. That goes into aligning with evolving needs. Again, just making the fine-tuning those things instead of setting times that we're going to make a change here. No, make a change as you go. Once there is a consensus to that's not working and someone has a different idea, change it. Try something else. I would encourage you to have a gradual and phased approach. One thing in my experience that we found is that when you tell people that you're going to implement something, sometimes the expectation is that, okay, we're going to be done in 3 months and it's going to be perfect. And so really just setting the expectation that that's not how true change happens, and that when you're challenging the status quo of total patient care that has been in place for decades and decades, it's not going to be, you're not going to reach the end of that journey in 3 months. Adapt to high volume days. I think when you lock yourself into certain things when you're doing a pilot and you don't account for high volume days, you're going to find yourself and your staff in some really stressful situations. So just allowing yourself some grace and some flexibility, because there will be days where you have a ton of call-ins and patient volumes are really high, and maybe you have to do things a little differently that day. And then you might have other days that volumes are really low. So you just have to be flexible, because that's what healthcare is, right? It's about that constant change, that constant fluctuation. I think we need to be fostering a culture of creative problem solving. In nursing, so much of what we do is evidence-based practice, and here's the evidence, and we need to do it that way. And all of those things are fantastic. And all of those things are really, really important when it comes to the interventions that we're doing on our patients. But on some of these workflows, you got to tell them there's not a paper that's going to give you the answer for this. I need you to think about, okay, if I could redesign what my day looked like, what would it be? And really just give them permission to be creative. And then when they are creative, really recognizing that and celebrating it, so that the next person says, well, I had this crazy idea and I wasn't going to say anything, but you know what? Maybe it will be well received. Learning from trial and error. In my experience, you have to fail several times before you're going to get it right. And the more you fail, you just know that you're getting closer to the right answer, because you've eliminated all the ways not to do it. Really being responsive to staff feedback. When you start changing a status quo and a culture on a unit, you're going to have a lot of feedback. And if you don't address it, it's not going to get better. But I think when you have honest conversations with caregivers and everyone's in agreement that burnout needs to be truly addressed and eliminated, you can tackle those things together. And your staff has to know that you're not going to give up, right? You really have to demonstrate that commitment to continuous improvement. And then again, just addressing those pain points and challenges. Don't be afraid to talk about the hard things. So there are so many benefits to implementing telehealth technologies and virtual nursing technology in a hospital setting, but we're just going to touch on a few. So the ability to alleviate physical challenges for nurses that previously felt forced away from the bedside. That is amazing. To take a nurse that you're like, man, I hate to lose them. Now you don't have to necessarily lose them. To really start mitigating burnout and decreasing the amount of work for the bedside nurse. To utilize the experience of those nurses, to support the new nurses coming in so that they don't feel that they don't have a mentor. To be able to focus and enhance care coordination, to where everyone is now working together better, and to really be able to reimagine what those teams look like at the bedside. I think that as far as augmenting the team, I think telehealth in general is really underutilized in the acute care setting. And so, again, I really see this as just a first step of how do we get everybody at the table, whether it's virtually or in person. Reducing that workload pressure, enhancing time management, just the time that you're able to give a bedside nurse back when a virtual nurse does an admission, you're talking 30 to 45 minutes, because asking them, if you're doing the admission correctly and you're asking them all of the questions and you're reviewing their prior to arrival meds, that is 45 minutes for sure. And so to be able to give that back to our bedside nurses, I think is really important. Improving patient-centered care. This is just another aspect, another layer to be able to meet the needs of the patients. To be able to increase job satisfaction. If nurses feel that their job is a dead end and that maybe they can power through for a few more years, they're not going to be satisfied whether they're having a good day or not. But to create an environment where they really feel like they're a part of making things better and that they can see that light at the end of the tunnel, even on the hard days, I think that they're going to be feeling better about their jobs. Retention and recruitment. I have had the opportunity to go and talk to some of the nursing schools and talk to some of the new graduate nurses and tell them about virtual nursing and about the virtual nursing that we did on my unit. And one thing that I tell them is that it's not perfect. It didn't solve all of the problems, but the promise is we are going to keep changing until we find the right thing, right? We're going to keep trying it until we reach a point where burnout is the exception and not the expectation. And this really, really resonates with them. When you're in nursing school, some of your first rotations are on the med surg floors. And so you're new and you're scared and you see nurses drowning. And then as you go through school, you do the more complicated rotations, you do ICU, you do ER, and then they graduate and they say, well, my only memory of med surg was that it was really hard and scary. Not everybody is cut out to be an ICU nurse. And so when I go and I give this type of presentation, even though I'm not offering them, a perfect model of care, just the hope is enough for so many of them to say, you know what, I think I want to go try that. And so I think that virtual nursing across the nation is going to play a huge role in recruitment and retention, in giving them the light at the end of the tunnel and saying, we're not going to settle for the status quo. We're going to, as healthcare in general, we are going to continue to work towards making your job better. And that alone sometimes is enough to keep them at the bedside, just that hope and the knowledge that you're working on it. virtual nursing does definitely have an impact on the culture. To go back to what I mentioned earlier about total patient care, that is deeply ingrained in hospital culture and deeply ingrained in how we see and how many people see themselves as a nurse. And so you really are, you're not just changing a workflow, you're changing the culture of the hospital and you're making it better. And so it's important to realize that it's not a small thing to ask someone to change their identity in their profession. And so to spend some time really engaging with everyone as they go through that journey is really important. The future of virtual nursing. So I think this will continue to expand across all healthcare systems in a variety of ways. You'll have some virtual nurses with, that are assigned to one unit in one program, and then at a different program, maybe they're over 3 units and they're actively looking in, 50 different charts. I think that you're going to start seeing data-driven insights. We're going to see the technology start to come into the hospitals. And I think in a lot of ways, you're going to see it through that virtual nursing door. That virtual nurse is going to have access to these analytics to help improve patient outcomes. I think that we're going to continue to see learning and adaptation. My hope is that nursing schools really start to incorporate education regarding telehealth technology and virtual nursing and different models of care into their curriculums, so that when nurses go out there, I want them exposed to more than just total patient care. I want their mind to be open so that they can be engaging and helping continue to change these models. And I really think that bringing in these types of technologies is going to help revolutionize healthcare. Again, long-term vision. I think that virtual nursing is going to be that digital support, and it's going to be an important piece of that police system. And the feedback that we are getting already across several organizations, when you read the different reviews, is really positive. People are comfortable with technology. Everyone has smartphones. There's no reason why they need to walk into a hospital and have the technology be 50 years old, right? It's the right thing to do for our society to start incorporating these technologies. Again, adapting to emerging technologies, and then really celebrating successes, and not just our own successes, but other institutions' successes. If there is a healthcare system that is really getting it right and finding great success, that should be celebrated. And other healthcare systems should be looking and going, okay, what are they doing? We need to do that as well. So that is all of my slides. I really appreciate everyone joining me for this. And if anyone has any questions, I would be happy to answer them.
Thank you for this great presentation and for the information. And is anyone having a question? Because I have a lot of questions to ask you. Okay. So let me start then. How do you alter the ratio? I know that we have these virtual nurses, but how does the nurse-patient ratio get altered with this virtual nursing? Does it improve the ratio, and how does the virtual nurse adapt to the different practices in different hospitals? So those are the 2 questions I have for you.
It varies completely from healthcare system to healthcare system. You have some healthcare systems that adjust the ratio and leverage ancillary support staff to justify changing the ratio at the bedside. You have other healthcare systems that they do not change their ratio at all, and they're really just bringing in the virtual nurse as a resource to the bedside. You have programs where virtual nurses are only available for parts of the shift. They're coming in at high admission or discharge times, and they're being utilized in the hospital where they're needed. And then you have other programs where you have a camera in every room, and they really are part of the care team of a specific unit. So there is great variation from hospital to hospital. As far as the justification for the ratios and the staffing, it's so individualized because a lot of it depends on the patient population that you're serving, to be able to collaborate with the staff to say, if we do this and we leverage this staff in this way and we have a virtual nurse, are we still providing safe care? And in some areas, that's going to be a hard ask, right? I mean, in areas that already have low patient ratios and really, really sick patients where you're taking care of trachs and vents, it is going to be a difficult thing to ask to remove a bedside nurse from that. In other areas where you have a lower patient acuity and you have a high turnover, where admissions and discharges are frequent, in those types of settings, you can actually justify changing your ratio at the bedside and substituting with a virtual nurse. So it really, that's a tough question because there's just such a variety happening in the United States right now.
Dr. George, actually, we visited and I saw in the audience, Dr. Pearl Merritt and Lamisha Hogan is there, which are nursing leaders here at TTUHSC. We visited TexLaHealth yesterday and we saw a bunch of hospitals, TexLaHealth, for instance, embracing virtual nursing and in different ways. Like they even have a telesitter wherein instead of nurse technician, and I think we have that in Julie Wright's, Providence Hospital, wherein instead of a technician being at the bedside, there's just one technician seeing 12 or so patients. So to tell them, decrease number of falls, to help them assist, with something, especially with patients with delirium and whatnot. My question, though, with Julie is, how do we prepare, our future nurses and our current nurses in the revolution of virtual nursing?
What I have found when I am out talking to nurses that don't work on my unit or nurses out at the different schools is there's really not a wide understanding of what a virtual nurse is. And so just sharing the things that we talked about today, all of the different interventions and things that virtual nursing can provide at the bedside. Because I think initially, if you don't know anything about it and you say your nurse is going to be virtual, even if you say that to a patient, that might make them very uncomfortable and scared, thinking, well, you're going to take my bedside nurses away and they're only going to be virtual. So addressing some of those misconceptions, really educating people on what a virtual nurse is capable of doing, and then also spreading knowledge and information about total patient care. Because again, I think, as previously discussed in one of those slides, healthcare systems in general, different departments are so siloed. And so, if I'm talking to you as the physician, I really need you to understand what total patient care means to a nurse so that I can have your support when I bring that virtual nurse in. And if you don't have an understanding of those different models, it's going to maybe be difficult for you to back me on that because all you see is that we're changing ratios, right? Or, maybe we're not changing ratios. Maybe you just don't trust the virtual nurse because you don't have a relationship with them and you don't know how experienced they are. So I think it is so important to bring everyone in and make sure that everybody has that same baseline of information.
Are there any questions from the audience as well? Oh, we have a question from Max. Go ahead, Max.
Okay, so like you were speaking about just a bit ago, Julie, when you were in the room and you needed a question, or you were just wanted to ask a question about meds or whatever. Would the virtual nurse in that instance have to be a licensed nurse, or can it be an administrative type person?
I think if you are asking someone to go into an EHR and review medications, it needs to be somebody with a license. We have certified nurse aides on our unit, and that is not within their scope.
Okay, that was my question.
And I think this will help, by the way, on some of our, nurses. A lot of nurses, especially during the COVID, retire actually because of the burden. They cannot do the lifting anymore and a lot of bedside procedure. However, they are still very helpful, in advising patients, in educating them about their disease process or their treatment, as well as their medication reconciliation. So I think visual nursing have a role. By the way, I have a question though, Julie. I know the nurses are doing a lot of great things, and I visited several, center of excellence in telemedicine, and a lot of them are actually nurses. Most of them are clinical nurses, and I think that makes them very successful. Dr. George is a physician. I am a physician. What are the things that we should do as a physician to help you make this project, make this endeavor successful?
I think that you should advocate to the systems that you work with to incorporate these technologies, that you should say, I want a virtual nurse to be available. If you come to my unit or several other programs where virtual nurses can beam in on the televisions, if you had a patient in that scenario and you were getting ready for surgery, and you know they're going to have questions when you walk out, if you can bring that virtual nurse in for that conversation, when you leave and that patient goes, now, what did they say about this? That virtual nurse can continue that conversation even after you've left. The other cool thing that you can do with these different technologies, you can send invites to their family members that are maybe in the next state, and they can be part of those conversations too. That is so important for families to be able to hear those conversations with physicians. You know, that's what we hear all the time. When is the doctor coming? I don't want to miss them. And so to have a technology that takes some of that pressure to be there in person off, and that they know the virtual nurse will send me a video link as soon as the physician is there, I think that that could really positively impact your patients. So just advocating for that and telling hospitals, this is important for our patients. We want you to invest in this.
Well, I think we have a question from Jamie Hernandez. You raise your hand. You could unmute yourself and ask a question.
Hello, Julie. I have some questions for you. Just the last year was spent with lots of dialogue around mandated staffing ratios amongst all of the national nursing organizations that came together, led by the American Nursing Association. And Providence Health System was one of the biggest voices at the table that determined or led to some of the final recommendations that the virtual nurse is not to be counted in mandated staffing ratios. And if they're not counted in mandated staffing ratios, and mandated staffing ratios do become part of our practice requirements across states, depending on legislation in each state, how do you build the business case for the virtual nurse in that case? Because if we're not counting them as part of that nursing patient ratio, and we do need to build a business case, how are we saving money enough to justify those positions?
I think that when you are looking at ratios, there's two things that, and this is not coming from, I'm not representing an organization when I say this, I'm representing myself and how I feel about ratios. I think some ratios in settings where there is not a safety net for nurses, ratios are important to say, we have to put a safety net in place to keep everybody safe. But at the same time, I think acknowledging that the model itself is broken and that we need to be actively changing that, because ratios alone are not the solution. I think that you have to include both of those pieces in that conversation. When we look at staffing in a hospital, we have grid staffing, which is what we want staffing to be, and we have workable staffing. And sometimes, a lot of times we land in the in-between. And I don't think that you can say, like, let's take a ratio in California, and they say, okay, you can have a 1 to 5. If you say that the virtual nurse can be included in that, what happens when you have a catastrophic event where your technology fails, right? What happens when your Wi-Fi goes out? What happens when your TVs break down? You have now lost a caregiver that is required. And so I think that the role of the virtual nurse, it can be incredibly impactful. I think it's the right thing to do for the patients. I don't think that it can be included in the ratio, because there are too many factors that if something were to happen, that would leave you in a dangerous situation as far as caring for patients. And as far as making the business case, this technology, it doesn't say for nurses only, right? So when you put this in a healthcare system and you now have cameras in the room and you have access to that, you don't have to limit it to the nurse, right? You can bring in social workers, case managers, consultants. You can bring in different physicians. I know that there's different rules regarding payment and different things like that, but there are a lot of administrative roles in the hospital that physically right now are walking all over to talk to patients. They would also be able to use this technology. So I think as far as manpower in general for everyone, this technology opens up, you know, all kinds of opportunities for other people to be engaging with the patient virtually. And I think that that's some of the business case, is that this is, you're not getting a camera for only a nurse, right? You're getting it for the healthcare system to be able to engage with the patient virtually.
That's a great idea as well in doing a multidisciplinary rounds. You know, there will be multiple specialty, like we have a nephrologist, you know, a trauma surgeon, intensivist, you know, seeing the patient with their family and their loved ones, right?
Mhm.
Any other questions from the audience? Benjamin, do you have any questions for Julie?
I was thinking, do you all have something in place to where, like, if you're doing like end of care discussion or something along that lines, like medications, do y'all like, have y'all ever like saved that, like that video or the voice recording so that like patients and family can like look at that afterwards?
To my knowledge, we here on my unit, I have not experienced that, but I think that that is a great example of how technology could be used to enhance care.
And they're using telemedicine, Benjamin, you know, in actually palliative medicine, you know, so rather than them going to the hospital, they are in the comfort of their home with their family members, and they're being guided on how to, you know, do the end of life issues as well, and end of life, you know, care of some of our patients. Julie, I have a quick question though. I know we're probably running out of time, but you know, are there any metrics or, you know, any measurements that we're using, you know, to see whether this is successful, or, you know, any metrics that we're using to make sure that we're doing quality of care, quality nursing to our patients?
I will say that in our pilot, we are of course gathering all of that. It's too early to be able to present that data and say conclusively, here's the things that it impacts, you know, without a doubt. I would say anecdotally, the stories that I'm hearing, the stories that I'm reading online from other healthcare organizations show that it is positively impacting their culture. There are patients that are having great experiences. There are staff that are feeling hopeful again. And so I think we're moving in the right direction, but I think that the data will come, but we're not there yet.
Well, another question, Julie, is, you know, we are so used to Florence Nightingale being at the bedside, you know, touching the patients and being empathetic. You know, are we losing those empathy characteristics because of all this virtual nursing and technology?
I think that you're actually gaining an opportunity for relationships, because when you have a nurse that is really spread thin, and that is the only relationship that the patient has, you're really cheating that patient. Right? They're not really getting those moments that they need. And when you bring in other people to that care team, whether it is ancillary support, virtual nursing, other people that are committed to that patient group, that patient now has an opportunity to build a relationship and build a trust with those clinicians as well, and to feel better supported. So instead of feeling like they had a few moments with that nurse, now they're having multiple moments and multiple relationships, and they're feeling supported more efficiently than ever before. And when I talked about the nurses being afraid to give up total patient care, they were afraid of losing that relationship piece too. And I will tell you from my experience, what we have found is that there is enough relationship to go around for everyone, right? Patients are not limited to having a connection with only one nurse. And so when you bring other people in, all it does is enhance their experience. It doesn't take away from it.
Well, Julie, I would just like to read some of the comments there from Jamie. You know, with that said, Colorado is leading change in nursing care to be reimbursable like our interprofessional colleagues. So great job, Julie. And hashtag throw away the box. We'll tweet that. And Brandy Wilson says the virtual nurse isn't rushed and has so much time to spend with the patient. Patients feel very important. And it seems like a concierge nursing, don't you think, Dr. George?
That is correct. Especially we have it in, I'm a nephrologist, and in home dialysis, we use, a lot of remote monitoring and virtual nurse technologies. So I really look forward to this whole event.
I'm actually, not to, make things complicated, but I think putting a wearables onto our patients so we could monitor them so they don't need to be waking up, in the middle of the night to take their vital signs. I think that would be great because most of the time, you will go there at 2 o'clock in the morning. Could I take your vital signs? You have a very angry patients, and I don't think they will recover better, if they'll keep on waking up every 4 hours or so.
Yeah, that's a great idea. I'm going to patent it.
Yeah, there you go. Let's do a wearables. And they will
Agreed.
be, and they could be, going into the record, so you don't need to put that individually, the vital signs.
Absolutely. That all goes into that digital support system that the healthcare really needs.
Well, I will encourage everyone to fill up their, session evaluation. Click on the QR code so you could get your CME and CNA units as well. Before we go, we would like to present Julie a challenge coin. Could you present that to Max? And thank you very much, Julie, again for this excellent presentation. We're giving you this challenge coin as a token of our appreciation to your pioneering work as well as your excellent presentation today. And next slide, before we go, there's a quick spotlight on our next installment of this telemedicine webinar series. We have my colleague, Dr. Daniele, who will be presenting on telemedicine application for breast cancer. And she's already doing this. And she's doing that for survivorship as well as for follow-up. And more information and registration link will be available on our websites and socials. It will be on Twitter and X in the near future. Thanks again for joining us. Thank you, Benjamin. Thank you, Laura and Max and Dr. George. Thank you very much. Thank you very much, Julie.
Thank
Thank
you.
you.
Thank you.